Okay, so Kevin Kruse here. I'll be in to see you shortly. But before I come in, there's a really important question that I want you to consider before I walk in. And this is a scoring system that we use for shoulders, and it's called the SANE score, SANE, and that stands for Single Assessment Numeric Evaluation. And this is a really important question, and it's vital information for me to kind of understand where you're at with your shoulder. So what I want you to think about is, if you had to rate your shoulder today on a scale of 1 to 100, if 100 is a perfect shoulder, you have full motion and no pain, and 1 is the worst shoulder imaginable, horrible, horrible pain, very little function, and you had to average that out over the last few weeks, 1 to 2 weeks, because I know the pain can come and go. I want you to think about what percentage of normal is your shoulder. Is it 25% of normal, 50% of normal, 75, 80, 90% of normal? If it's 100% normal, you would never be here. So that doesn't really make sense. But I want you to try to think about it, and I'm gonna really make you put a number on your shoulder, and I want you to think about that. So when I'm in here and we really dive into what's going on, I can have that number, and it really tells me a lot about where you're at with the shoulder. And we have found that number is very, very it just gives us a ton of information. Almost the same amount of information as our very long questionnaires, which have 15 to 20 questions about your shoulder. And it's actually, it also helps us track, where you're at before we start your treatment and after your treatment. And it helps us keep things very objective. So think about what your score is, and I'll be in soon.